We are going to try to give a couple minutes for questions, so I'd invite our panelists back up to the front. There's a chair for each of you. Also, questioners, as you can see, we're going to try to make up some time with the Q&A, so please limit your question just to one, and then connect with our speakers, try to catch them on the way to the bathroom, and ask any additional questions. So we'll get started right here.
So for the VA MOVE program, I'm wondering if you have any data by branch of service, any differences between the branches of service that people served in that you see in that.
Okay. Can you hear me? So I don't have that information. We might be able to look at it like that. I think that's a great idea. So I haven't looked at it, but I think we can. We have information on veterans in terms of what branch they serve, so that's something we can try and look at in the future.
Just based on what we heard this morning, I just wonder if any Marines are in your program.
Yeah, a couple, I think.
Thank you. You over here?
Chris Economos, Tufts University. Thank you for that great overview. It was terrific. My question is, I have two. One specifically for the Go for Green program. Was she up here? Oh, yeah, okay, great. So you showed on the slide that they have to have a certain percentage of healthy meals in order to qualify as a site. I couldn't read the number, but I wonder if you could talk about why you chose that number and if there's a plan to elevate it more.
Yeah, there was a lot of thought that went into that. Certainly there was discussion across all of the services about what was feasible, not just what was the target ultimately. And so that initial target is that 30% of the menu would be coded as green, and we're emphasizing that at least one component, one item at every station in the dining facility would be green coded, so that there would be at least one green coded choice at the short order or at the main line and so on in each station. So again, that was based on what was expected to be feasibility, and really with a lot of input from each service and from the Armed Forces Recipe Service.
Yeah, it looked like you're meeting that when you showed the pie chart, which is great. But any thoughts about trying to push it even further?
Eventually, but although we showed you a success, I guess, in terms of a menu at a case study location, but certainly across the enterprise, many facilities will be challenged to change their menu and still meet that.
And I can actually say something to that. Being a dietitian who's run food service before and just coming back from Vicenza for our Healthy Army community, there's some restrictions still that we have to wait until the Joint Buyer's Guide and the DLA catch up with the Go for Green standards. Because spaghetti sauce, which if you're using whole grain pasta and spaghetti sauce, in my mind that would be a green item, but it's not because there's added sugar. So now you have spaghetti and it's yellow. But as a dietitian, I don't have a problem putting spaghetti in my line. So is there an issue with the percentage of yellow items on a main line? Absolutely not.
And second question really quick, because I got cut off last time, so okay. I'm just making up for it. Anyone looked at spillover in the greater families? So some of these programs are very targeted. They're delivered one-on-one, spillover into the other adult in the household or children, seeing if there's a larger return on investments you're making. Do you know about any of that?
So when you say spillover, we absolutely invite soldiers to bring their spouse to the Fit for Performance classes. So they are encouraged to bring their families because we understand that the spouse is heavily involved. And then also some of the things that we're looking at too, we try to take a part of that with a lot of the DECA initiatives. So the commissary initiatives where they have the thinking outside the box and the program guide that we're trying to target spouses as well. Yeah. So
yeah, but I was thinking of measurement too to see if there's a effective.
Very difficult to measure beneficiaries, family members in that aspect.
Thank you.
Thank you. Okay.
Hello, Ryan Union, Navy. This question is really for Brian. On the BCP program, is there a mandated weekly weight loss that the Marines have to meet every week they go in? And what is that number by any chance?
Okay, prior to being formally assigned to the BCP program, the The Marine who is out of standards consults with our Navy medicine assets, and the doctor or the provider makes recommendations on what the recommended monthly weight loss is, not weekly weight loss, although the Marines are weighed every week. So it varies from Marine to Marine, and sometimes it's as simple as if a Marine is 15 pounds overweight, dividing that by 6, et cetera. In more extreme cases, it's not a monolithic, set per month, and the Marine does get periodic follow-on assessments after being assigned.
Okay, so let me get clear. So there is no mandated 5 pounds per week that the Marines have to hit every time?
No, and that the weight loss that is recommended is balanced with the Marine's health. We certainly do not want, the Marine to go on the first sergeant's salad and sauna program, to just rapidly lose the weight. We want, in fact, the first assignment to the body composition program is a mandatory 6 months, no matter how quickly they got off it. It's one heck of an incentive, but it's also another means to institutionalize the weight loss strategies.
I understand. I'll talk offline with you. A question after this.
Okay.
The other question I had was just that.
We're gonna. We might have time for another one. We're doing pretty good on time. Ma'am, did you have one? Yes. Okay. Yes, please.
Naomi,
we'll come back to you.
Oh, sorry. Naomi Fukugawa from the USDA Beltsville Human Nutrition Research Center. And I want to applaud all of you for such innovative programs and really the efforts that one can see within the armed forces of trying to harmonize nutrition education as well as provision of healthy approaches to life. My question, and I may be very naive at this, but is there any chance that we could then have intergovernmental agencies to harmonize our messages and our programs such that we don't duplicate efforts but really reach a broader group of Americans? Just a question. And I think Carl will follow up with that.
As in a whole of government sort of way?
Well, I'm just thinking, for example, the procurement program. I can't remember.
Actually, I'd like to respond to that one. So we are in a lot of ways, or at least communicating. So Dr. Rafa and I communicate with the DoD. I co-chair the M&T working group for DoD. We do share those resources toolkits. Sean has shared his Healthy Teaching Kitchen toolkit with the DoD. And then not on the DLA side, but we also share the subsistence contract. So Veterans Health Administration shares the contract with Indian Health Services and DoD for the healthcare sector. So we do share purchasing power. The chicken breast example was given, I believe, by Ms. Lindberg, and that's so true. We harness that power. We talk about standardization or how to make those choices healthier. So it is not something that emerged from all these differences on the stage, but it's underlying that we do communicate and share resources.
Well, I'm sort of making a plea wearing a USDA hat that the USDA sort of potentially be incorporated.
We've also done
I know someone speaking from NIFA later this afternoon, but.
We've also done other collaborations where recently I had the amazing opportunity to spend a one-year fellowship at the Center for Disease Control and Prevention, and we're doing a lot of collaboration. DoD was among 9 or 12 other governmental agencies involved in the food service guidelines, and the Go for Green, the MNEAT that we're using to assess our military installations are all using the food service guidelines or based off of the food service guidelines. And as you can see, we're starting to get more DoD programs with MNEAT, Go for Green. HAC and the Smart Fueling Initiative are extremely similar. And recently, Lieutenant Colonel Harwood actually brought us together because we're looking at taking this is very new, but taking the best of the Navy, Air Force, Marine, and Army to have one fit for performance, one weight control program. So it's in the beginnings, and we're looking at that. So there's a lot of collaboration going on among us.
So to go with Naomi's question, how do we define a healthy diet? We all talk about it as if we all know what a healthy diet is, and somebody's going to say, well, it's low salt, Of course, if it's somebody who needs weight loss, then it's a low-calorie diet. But, you know, I mean, when we've tried to do this before, we say, well, a balanced and varied diet, right? But is it really 8 helpings of fruits and veggies that are going to solve all our problems for, you know, our goals in the Army program? I don't think we have consistency on the definition of a healthy diet. Do you want to take a shot at what that means? Is it more fresh foods? Less processed?
Working for 1 year at the Center for Disease Control and Prevention, that's one thing. There is no definition of healthy. And so that's what is the definition of healthy? And oftentimes we use the word healthier. And so because that's still being debated, but basically using the dietary guidelines for Americans based off the USDA and the food service guidelines. So those items are what we in the Department of Defense are using as healthy.
So we need Naomi's help to lead the charge, maybe. Kevin Hall's doing a study at NIH, or he's proposed one, where he's going to compare feeding processed foods to non-processed foods, just, you know, without really defining that further, and just see what the health outcomes are.
Well, that's actually one of the
sure.
aspects of Go for Green 2.0, because Beth didn't have a chance to talk too intently about it, but Go for Green 2.0, when it's coded as green, there's certain aspects of the amount of fiber in it and less processing. So an item is green when you're taking out the processing. So I can let you start.
Yeah, so just to add to that, yeah, in the development of the criteria on which we base, and there's a paper accessible through our website where we reviewed the basis for those criteria, and it's in an attempt to link up with the dietary guidelines with unique military requirements, such as, you know, are outlined in MDRIs, and then also builds off of that general algorithm of less processed, more whole foods, and not steering people towards a particular macronutrient percentage, but looking at the quality of the actual foods.
And in general, I'd say with any healthy diet, we need to have a large heaping serving of education. Because we have to, it's not like everybody's going to the chow hall and can choose one of this and one of that. We need to teach people to be able to make their own informed decisions. And until we do that, it really doesn't matter what numbers we come up with. The healthy diet is one that's easy to follow and produces results.
And Sean is absolutely right, and I agree with Major Osgood as well. The VA has a policy published for healthy diet guidelines, so there are the VA healthy diet guidelines that are very strict, and we measure them annually on our menus, ask each facility to report on fiber, sodium, fat, and they very closely mirror the dietary guidelines and American Heart Association levels. We'll have time for one more question to Carrie Harris.
Thank you guys for presenting today. So I'm going to plant this question because I already know that you know the answer, so rest assured. So I'm asking this question because I want to highlight the fact that there's a lot of synergy across the services, but from the outside looking in, it may not be that obvious that all of you know each other and you also work together on a lot of these initiatives. MNEAT was something that kind of got spattered through all of those. Go for Green is happening that's across all the services, but can you name some other avenues of collaboration that you know the services use to work together on these programs on nutrition?
I'll kick it off with the primary avenue that is used as we meet twice annually as a DoD nutrition committee. And that's an opportunity for many of the leaders across each service and various organizations working and affiliated with DoD to come together, and a forum where some of these programs can be discussed. And from that group, there exists multiple working groups which focus on multiple different areas, of which Karen Hawkins chairs a environmental nutrition working group, and I've been involved in the Go for Green working group.
The Operation Supplement Safety working group as well.
The DoD Nutrition Committee is broken into two main. So you've got the food and nutrition, and then you've got the supplemental. And I do talk with my hands. I'm going to keep doing that. It helps. And so we kind of break apart. So you've got the Food and Nutrition Committee as well as Supplement Committee. And this is like a reunion for all of us because we just saw each other very recently. And almost all the speakers that have spoke today, we do work together very closely. And under the Food Nutrition subcommittee of the Nutrition Committee, Karen Hawkins is the chair for the Military Nutrition Environmental, looking at the environment of military installation, predominantly the MNEAT tool that we're using, but we also have an MNT group, as well as, help me out, ladies.
Performance nutrition.
Performance
and
nutrition,
a food
and of
service
course,
working group. Yep.
the food service working group, right? And then we break out subgroups when needed for special items like Go for Green 2.0. And it's not just active duty members in military and VA, but we also bring in our stakeholders. So we have the APES representative, we have the DECA representative, we have the NWR representative. So people who are actually doing food, the Joint Culinary School that does all of our dining facilities comes to that meeting too. So we all come together.
We also have Operation Supplement Safety that we all sit on, and then also the tobacco that your office chairs as well.
Yeah, so outside of just just the nutrition environment, there a lot of Colonel Hayward, like at Harvard, she's on my tobacco subcommittee, and we've never met before except for right now, man. So DoD is partnering across the board for multiple health promotion initiatives. A lot of the people sitting here today actually contributed to updating the DoD Instruction 1010.10, which is the health promotion DoD for the entire Department of Defense that guides the military services on how they are to construct their policies. Right now, we're in the process of updating a DHA policy instruction based off of DoD 1010.04, which is substance misuse within the Department of Defense. And with all of these, policy updates, we actually do invite stakeholders from outside of just the department and leaders in the field to add their 2 cents.
Well, that is a fitting conclusion from a message from our leadership representative, Captain Vu. And I'd like to ask you to please thank our panel with a round of applause. We will have a physical activity break. Jim Salas will come bring us back to Mexico, I believe he said, with some physical activity break. And please, you've got 10 minutes for a bio break after our stretch, so be back in your seats at 3:20. 10 minutes.
Hello. Please remain standing, and let's march a little. Let's march a little, warm up ourselves. And I'm going to do something a little different. After the morning break, somebody said, well, you didn't do line dancing. So we're going to do the very simplest line dancing, horizontal line only. All right, so let's try something very simple. We're going to take 2 steps to this way, all right, and then lift your knee, all right, 2 steps that way, lift your knee, 2 steps back to the middle, and clap. Okay, so you ready? 1, 2, 3. This way, 2 steps up. This way, 2 steps up. 2 steps this way, clap. There we go. Now we have some rhythm going. We'll try it again. I think you want to clap more. So we're going to clap when we lift our knees as well. So this way. 1, 2, clap. 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 Okay, very good. Now let's just do a big stretch all the way up and deep breath and go all the way down. Thank you, and have a good break.